In a country like Malawi, the population is still increasing. 50% of the population is under 15, and so pediatric surgery here is a specialty with huge requirements and huge needs.
So KidSURG is a program that's aimed to improve surgical care, focusing on the pediatric patients.
There are almost no medical doctors in district hospitals in rural Malawi, but there are clinical officers who are non-physician clinicians, and we know that they can do essential surgical procedures safely because we have scientific evidence from previous West Africa and South Africa projects. So now in KidSURG, we're expanding their skills so they can care for the many children that present to their hospitals right there and then without the need for referral. This approach to widening access to children's surgery in rural Africa has never been tried before, so that is what makes this project innovative and very exciting.
So the aim of the program is to go into the districts, mentor clinical officers, mentor nurses, or any patient that comes into contact with a patient, so that they can improve clinical care and surgical outcomes for patients.
There's missing equipment, there's staff who've not been trained. So those are major constraints we found in the course of the project. We need to do a lot more training in the district. We want to encourage them to be operating on more children independently there.
It is a very good initiative. One, it has helped us as a district to improve our patient management. Whenever we had those kids, our first thing was to refer them to Queens. Issues of prereferral management, we didn't have adequate skills. Two, on the patient assessment, we didn't know which patients to refer and which ones not to refer. And also on the guardian counseling, we didn't know the explanations that we needed to give to the guardians.
We normally talk to the consultants at Queens and we discuss and reach a point of what we should do with the patient.
So the Surge Africa program started with doing a district outreach where districts were able to send WhatsApp message or have direct contact with specialists at the central hospital. So there's already the Surge Africa platform. On the platform we have the specialists, they have us as specialists in trainings, they have the intensivists at the central hospital, they have the anesthetists. They also sometimes have some nurses on the platform. So in Surge Africa, there was already a platform for communicating patients that were being referred for surgical care. So now KidSURG also uses the same platforms and the same district community who was already built up with the Surge Africa program to refer patients.
If you compare it to when we started a few years ago, there's been an absolutely great improvement. And the thing about the managed clinical network is it's not just between the person referring and the person receiving, but it's a very broad network with several hundred of the clinicians in Southern Malawi on it. And so, the impact of the training that's delivered through that and the advice is very, very significant.
The project is really important because it brings surgical care to the patients. Because if you look at Malawi, most of the patients are in very rural areas and they're really far away from specialist care. So the program works to bring pediatric surgeons, trainees who are involved in direct surgical care to bring closer to the patients. So when you bring the doctor closer to the patients, you're able to see the patients sooner. You're able to also educate the district to what the patient needs.